quickly cover anticholinergic agents. So we have been talking about these over the past couple weeks since this course started. So they will probably be a little bit familiar with you. So how do anticholinergic drugs work? So they work. These are usually medications that we give that will oppose the effects of acetylcholine at those acetylcholine receptor sites. So if you don't remember what acetylcholine does, you would want to go ahead into your book and find out, in your book where acetylcholine is, and find out exactly what it is, what the job is of acetylcholine and how it reacts in the body. And then you will understand that an anticholinergic drug will oppose the effects of acetylcholine. So they work to block the effects of acetylcholine. They also lyse or block the effects of our parasympathetic nervous system. You may also hear them referred to as parasympathetic agents. So we did talk today about the parasympathetic nervous system, and remember, it is the opposite of our sympathetic nervous system. So everything in our parasympathetic nervous system is going to be down, with the exception of what? Mainly we were talking about our GI secretions, correct? So these will block the effects of the PNS. So we do have medications that we can give. These medications will decrease GI activity and those secretions. So if we can control how much acid and stuff like that is secreted in the stomach, we will be able to treat ulcers. And then we can, these medications will decrease the parasympathetic activities to allow some of those sympathetic nervous system to be able to come in and be more dominant when it needs to be. All right, so one of our most popular anticholinergic medications that we give is atropine. You do need to know atropine for your exam. So we use these medications to depress salivation and bronchial secretions, and also to dilate our bronchi to get more air in. It can also thicken respiratory secretions, and it can cause obstruction of airway. So we do have to be careful. It's used to inhibit that vagal response inside the heart, to keep our heart rate from dropping. We also use it to relax the GI and the GU tracts, to inhibit GI secretions, and we can use it to cause relaxation of the pupil of the eye. Another medication that we give is scopolamine. We like to use scopolamine patches a lot on the back of the ear. They help a lot with nausea and to dry things up inside the body. This type of medication is going to act more specifically on the receptors that we have located in our GI tract. And sometimes you'll see that we'll add this medication on to other medications that we're using to treat patients that have peptic ulcer disease. And then we have oxybutynin chloride is a medication that we will give to relax the bladder and the urethra. So we use these medications a lot for overactive bladder and patients that are having bladder spasms. So I would know all three of these medications for your exam. So these medications come from a plant, okay? They act by competing with acetylcholine at those acetylcholine receptor sites. They do not block your nicotinic receptors. You don't need to know this specifically for your exam. So these medications, if we go in and we block our parasympathetic nervous system, we know now what our parasympathetic nervous system does, so we can anticipate what we would see. So we would see an increase in our heart rate. We would see a decrease in our GI activity and in our bladder tone and our function. And we would see pupil dilation. So this is, I grabbed this from your book. This is just some of the your anticholinergic areas where we use them and what effect we would see on the body. So again, they will block the acetylcholine receptors at that receptor site. We would give it if we were going to decrease secretions in patients. So we give these medications at end of life when people are very, very wet and they have a lot of fluid in their lungs. We would do it to restore cardiac rate and blood pressure. So if our heart rate and our blood pressure are too low, we can use it for pylorospasms or hyperactive bowel. And we can also use it to relax the hypertonicity that some people will develop in their uterus. You do not need to know this for your exam, but they're well absorbed. They get distributed throughout the body. We would want to look at our kidney enzymes for this medication because it is excreted in the urine. We definitely would not want to use if they have an allergy. We definitely would not want to use if they have glaucoma because we know these medications are going to increase the pressure in the eye. Okay. Same thing with our peptic ulcer disease, which we just talked about, and our bladder obstruction. So what are some adverse reactions that we would see with these anticholinergic drugs? So blurred vision, mydriasis, cycloplegia, photophobia, maybe some heart palpitations and some low heart rate, which is bradycardia, dry mouth, maybe our food doesn't taste the way we normally think it would be tasting, hesitancy and maybe retention with urine. And then the body would not be able to thermoregulate effectively. So we wouldn't be able to sweat as much as we normally would when our body overheats. So we're at risk for, suffering heat-related injuries. And mydriasis is going to be your medical term for dilated pupils. All right, so we would not want to use with other medications with anticholinergic activity. So we talked about our antihistamines and our anti-Parkinson's medications. We know they're anticholinergic, so we would want to be careful combining them. And then lastly, thinking of how these medications work. So at the cholinergic receptor sites, these anticholinergic medications are going to block the effects of acetylcholine. Okay, they're blocking the effects of the parasympathetic nervous system. So you may also hear them referred to as the parasympathetic drugs. So remember, when our parasympathetic system is blocked, the pupils will dilate, the heart rate increases, and GI activity and urinary bladder tone will decrease.